Good afternoon and welcome to our training here at the McDowell Senior Center entitled Medicare 101. My name is Waylon Freemore. I'm director for the McDowell Senior Center, and I'm also a volunteer with the North Carolina Department of Insurance, Seniors Health Information. Let's see. North Carolina Seniors Health Insurance Information Program. And it's nice, I've only been working with it for 20 years, so as you can tell, I'm right on the ball here today and remembering that name. But it's so great to have you all here joining us. And for those of you watching wherever, on your computer, on your smartphone, on television, thank you also for joining us today and learning about Medicare. Our guest speaker for today, her name is Billie Lister, and she is the Western North Carolina manager for SHIIP. And I'll let her go ahead and introduce herself, and thank you for being here today, Billie.
Thank you. Nice to be back home. I'm a McDowell County native. As you could tell, I say McDowell. That's how you know I'm from here. And so I'm happy to be here to talk with you about Medicare. As Waylon said, we work for the North Carolina Department of Insurance, and I'm the Western Regional Manager, which means that I help the whole western end of the state of North Carolina with Medicare decisions. But we're not affiliated with any insurance company. We sell no products to you. We do not endorse or recommend one product over the other. We're simply here to educate you on your Medicare options so that you make informed decisions as consumers. And we find that that's one of the most important things. There's so many different companies and plan options out there that it can be overwhelming as you begin your Medicare journey. So we hope that we are able to give you the information you need to make a really smart decision about your Medicare. And so, with that, we'll get started, and my information is on the screen. Should you have questions, though, I highly urge you to contact Waylon here at the Senior Center, as he is your SHIIP coordinator for McDowell County, and he will be able to answer any questions and make you in-person appointments. But I am also available, and Waylon will often refer folks to me if they get too full on the schedule here. So we're always happy to assist in any way we can. So today we're going to talk about the basic information that all Medicare beneficiaries should be aware of as they begin Medicare. And so we'll talk about what Medicare is. It is, of course, a federally funded individual health insurance program, and it will provide coverage for any medically necessary procedure services or supplies and equipment. And you become eligible for Medicare when you're turning 65 if you participated in the Social Security system or the railroad retirement system. If you're an employee of a federal, local government, or state government, or your spouse was, that will also make you eligible. And then if you're under 65, if you've been awarded Social Security or railroad retirement disability, after you've been on disability for 2 years or more, you'll transition to Medicare. And then there are some folks who have Lou Gehrig's disease or end-stage renal failure. They become instantly eligible for Medicare due to their chronic illness. So I want everyone to really look at this screen. There are 3 logos on here that are very important because as you near Medicare eligibility, you will be given so much information. You will get all kinds of things in the mail, and you'll wonder, is this really for Medicare or is it not? And so these logos let you know what are legitimate government information coming to your doorstep and what maybe is just a planned sales pitch. So Medicare itself is administered by the Centers for Medicare and Medicaid Services, or CMS. And so when you begin Medicare, your Medicare card comes, every claim that gets processed through Original Medicare goes through CMS. And CMS is a branch of the Department of Health and Human Services, or DHHS, and so sometimes your mail will have the little eagle logo on it. And then, of course, everybody starts out by determining their eligibility by contacting the Social Security Administration. And they are the only agency that is responsible for Medicare eligibility and enrollment. So absolutely everybody that starts Medicare must start with contacting the Social Security Administration to determine their eligibility and to enroll in the program. So, let's ask ourselves, do we need to know when to enroll? Yes, you definitely need to know. But some folks will be automatically enrolled. So let's talk about when we might be automatically enrolled and when that will happen versus those of us who will not become automatically enrolled and would then need to initiate that enrollment. So if you are collecting your Social Security benefits or disability before you turn 65, you will be automatically enrolled 3 months before your 65th birthday. You're going to get your card in the mail, and it will begin the first day of the month you're turning 65. Unless you turn 65 on the first of the month, you'll begin the month before your birth month. So that's really important to know that coverage always starts on the first day of a month, never before. And if you're already on Social Security or you're receiving disability, that eligibility happens automatically and the card will come automatically without you having to initiate that process. But you should be seeing that card come in the mail about 3 months prior to your eligibility. And so if you're nearing 65 and you're within a few weeks of your birth month and you haven't seen that card yet, then you might have a problem and you might want to call and check up on what is the delay in that process. It should happen automatically if you're collecting your benefits. Now, for those of you who are not going to be collecting benefits from Social Security before you turn 65, you have an initial enrollment period. And I want you to remember this initial enrollment period because this will determine whether or not you'll have late enrollment penalties. And unfortunately, late enrollment penalties are a lifetime. They do not disappear. So it's very important that you don't miss your initial enrollment period if you are required to initiate that process. So it's going to be 3 months before your 65th birth month, the month that you're turning 65, and 3 months after. And as long as you have called the Social Security office and initiated your enrollment in Medicare during that 7-month period, you would not be subject to late enrollment penalties on Part D or Part B, okay? And so I still want you to understand, though, that when you enroll will dictate when your Medicare begins. So yes, your Medicare should begin the first day of the month you're turning 65, or the month before if you're born on the 1st. But if you do not enroll until the month you're turning 65 or one of those 3 months after, your Medicare will not begin until the following month after you have completed your initial enrollment. So if we want our Medicare to begin that first day of the month we're turning 65, we need to start this process 3 months before our birth month. Now I'm going to tell you, like my granny always said, don't lollygag. You need to get that done. Start 3 months before because you need time to research these decisions that you're about to make. And they will impact you the rest of your time. So you want to make a really sound decision for you. Okay? And there are decisions that you can make that are much harder or impossible to reverse. So I want you to understand what those decisions are so that you are going in eyes wide open and not kind of snowed under by what we hear on TV or in the mail. So if you did lollygag and you missed that enrollment, I don't want you to panic. There is a general enrollment period every year, January 1st through March the 31st. The first quarter of the year is general enrollment. So if you missed your initial enrollment, you can call Social Security the first 3 months of every year and say, hey, I missed it and I want to jump on the Medicare train, and they're going to put you right in there. But your benefit will not begin until it doesn't go backward. So it's going to start the first day of the following month after you've completed that application process. So unfortunately, you may still be subject to a late enrollment penalty depending on your situation, okay? Now, let's just go ahead and get the ugly part out of the way. What is the late enrollment penalty for Part B? Well, it's 10% of the premium for each year you delay. So if I was supposed to enroll at 65 and I didn't do it because I didn't want to, and now I'm sick and I'm 70 and I really want to go to the doctor and I want Medicare, and now I'm 70 and I join up, I'm going to have 5 years worth of that late enrollment penalty, right? But they're going to go back and they're going to look at what was the Part B premium each year that I missed. And so they're going to look backwards 5 years ago and they're going to say, well, this year that were in question, the penalty would be 10% of that year, and then 10% of year 2, 10% of year 3, 10% of year 4, right? They're going to look at each of those years, whatever the Part B premium is, they're going to add 10% for each and every year I missed. And so it accrues. It gets steeper and steeper. So the longer I wait, the worse that penalty is. And again, that 10% gets added onto the current premium, and it never goes away. So I definitely don't want to miss my initial enrollment period. Now, there are folks that absolutely can skip enrollment. So let's talk about who they are. There are special enrollment periods for folks. So if you are working full-time and you're covered under an employer group health plan, you do not have to enroll in Medicare on your 65th birthday. You can opt, if your employer allows you to remain with your employer group health plan as long as you're continuing to work full-time and you're continuously covered under that plan. But there are some caveats. Yes, ma'am.
Does that work if, I know a woman in that situation, does that work for her because her husband had insurance on her?
Yes, so the question was if your spouse is working and covering you under their plan, yes, that can also get you out of that late enrollment penalty. But there are caveats to that. So you have to first make sure with your employer that they allow you to remain on the employer group health plan after you're 65, because some employers do not. Some employers require you to take your Medicare when you turn 65. Other situations could be that you are working for a small employer, and so while you won't have a late enrollment penalty, that employer may allow you to stay on their plan. You may still have Medicare would be primary in that case, and you may still have to pay everything Medicare would pay even though you're covered under your employer group health plan. So we're not going to cover all the different situations involved if you remain working and you decide to delay. But what I will say is if you sit down with a SHIIP counselor, we will go over the ins and outs and the pros and cons of that. And so I will also say that there are certain circumstances, so if you have TRICARE for Life or CHAMP VA and you want to keep those benefits, when you turn 65, you absolutely must take your Medicare A and B. You do not get to opt out of that. And so for these reasons, we say go cautiously if you're 65 and you're deciding to delay. Before you make that final decision, sit down with a SHIIP counselor. Again, we're not affiliated with any companies, and it's no skin off our teeth if you take Medicare or you don't, but we do want you to make an informed decision because we don't want you to regret it later. And so it's very important to understand what the penalty would be if you fail to enroll and you should have enrolled, and what are some of the considerations before you make that decision. All right, so now I think one of the most important things is to understand exactly what Medicare is. When we say Medicare A and B, what are we talking about? And so, and how do we enroll in that? Well, I told you earlier, the only way to enroll is through the Social Security office. And they no longer allow walk-ins, so you're going to have to call them and make an appointment. They will still see you in person, but I'm telling you, in this day and age, it's not even necessary. You don't have to walk in a Social Security office at all. Call them on the phone. They'll enroll you over the phone. You can do it online if you like to. So we put these links up here for you. You can go online to www.ssa.gov, and you'll need to create your socialsecurity.gov account. If you haven't done that already, I highly urge you to do that before someone else claims your account on your behalf. And you can call them. 1-800-772-1213 is the national hotline. Okay, and they're available to you Monday through Friday from 7 to 7. But that national hotline will take you much longer than if you just call your local office. So I urge you to reach out to your local office. They're going to be one of you. They're going to speak our accent. They're going to understand Appalachian American, and they're going to be able to help you, okay? And if you did need to go in person, that's where you would go, is your local office, okay? So I urge you to call your local folks just because it's a shorter phone call and they're your neighbor. So it's always nice to talk to your neighbors. So now let's talk about what are all the components or the parts of Medicare. And I want you to realize that I'm saying the parts of Medicare, not Medicare plans. Very different words, but they sound alike. So the parts of Medicare are just the components that build up the program. So we have Part A, which is our hospital, and Part B, which is outpatient medical. And those two are lovingly referred to as original Medicare. And if all I ever take is Medicare A and B, that is actually managed by the federal government, or CMS. So that means that they don't really offer managed care. Original Medicare is simply a Medicare coverage. So when I go to the doctor, I'll pay my part, Medicare will pay their part, but all the claims go to the federal government, to CMS, and they are processing those claims and making the determinations. And so it's very easy when you have original Medicare because you don't have to worry about networks and all of that. You just go to the doctor, pay your part, and Uncle Sam pays his part. So it's super easy, right? Then we have Medicare Part C. Part C are private companies who have contracted with Medicare to manage your health benefit in place of the federal government. So if you have Medicare Part C, you no longer have original Medicare. The federal government no longer processes your claims. You now have a private company who's going to offer you managed care, very similar to employer group health plans. So most of us are very used to managed care, and it doesn't frighten us, right? But there are pros and cons, and it runs differently. And so it's super important for us to understand the difference between original Medicare, which is not managed care, and Advantage plans, which are managed care plans. And so we will talk about those differences today and the pros and cons of each. Now, Medicare Part D are drug plans. And that one's easy to remember because D for drugs. But Medicare Part D works with original Medicare A and B to provide outpatient drug coverage. And so it's just that simple. Again, it's private companies with Medicare contracts to offer this service. So we can see from this that we have two major paths. We have the original Medicare path, and then we have the Advantage plan path. So if we take the original Medicare path, A and B, Uncle Sam's handling all of our claims, and we're going to need to pick up some kind of coverage for drugs because it won't cover drugs. And we're going to potentially select a supplemental or secondary insurance. So kind of think of original Medicare like you would car insurance. Original Medicare A and B is your liability. It's what everybody's got to have. And then the supplement or secondary is similar to comp and collision. It's optional. You don't got to have it, but it's a good idea, right? And so we're going to look at original Medicare and what the pros and cons are for that and what your options are if you take that original Medicare path. And then we'll look at the alternative to original Medicare, which are Advantage plans. And again, those managed care plans offered by private companies and how they work differently from original Medicare and how they're alike. So we're going to start with original Medicare because everybody starts there. So when you first sign up, you'll have A and B. And again, I said Part A is your hospital insurance, so it's going to cover you anytime you're spending the night at the facility, right? So it's all the inpatient stuff, even skilled nursing, but a little caveat there, you will need to be in a hospital for 3 days or longer prior to being discharged to skilled nursing. So it's not long-term care. We're talking about rehab. We're talking about, I need just a little extra skilled nursing, right? So we'll cover that. It will cover home health care in some circumstances. So if I'm at a rehab facility and I need a particular service that that facility does not offer me, they will provide that through Part A, and they'll bring in an in-home therapist, right? And the same thing with hospice. If I'm inpatient or if I have hospice care, that's covered under Part A, as well as blood transfusions that happen when I'm inpatient. Now, Medicare Part B is everything else that's outpatient, okay? So doctors and any physician service really, if I'm going to the doctor or the specialist and coming home, any outpatient hospital visits, whether it's the ER or the lab, or I'm just having an outpatient surgery, that's covered under Part B. Durable medical equipment and almost all home health is covered under Part B, and preventative services. And then blood transfusions, if they're outpatient, are covered under Part B. So now this is the worst slide. Nobody throw anything at me. I don't make any of these rules, okay? But original Medicare has some things it does not cover. What are those? Well, drugs. That's why they required you to have drug coverage under Medicare Part D. And routine dental care is never covered by original Medicare, which means I can't get extractions, fillings, dentures, x-rays, cleanings, none of that. However, if I get oral cancer, or if I get in a car accident and I break my jaw from the airbag and I need a maxillofacial surgeon, that would be covered under Medicare. The same thing kind of works with our eyes. So we know eyes, teeth, ears, they all go bad as we age. And those things, unfortunately, are not covered under original Medicare. But what I will say about your eye care is that you will get a preventative eye health exam. Original Medicare covers cataracts, glaucoma, any problems with your eyeball, it will cover. Just vision, it does not cover. So you won't be able to get glasses or acuity screenings, but you will get an eye health exam, and anything related to the eyeball itself is covered under Medicare, okay? Hearing aids, also not covered by original Medicare. However, you can go to the doctor and that will be covered so that the doctor can tell you that you have a hearing problem. I suspect you probably already know if you do, but Medicare will pay for the doctor to give you the official diagnosis. And of course, foreign travel, not covered under original Medicare. And cosmetic procedures, so if anything needs to be put back where it belongs or you want to look prettier, you're going to have to work on that before you turn 65 and start Medicare. And of course, as I mentioned earlier, long-term care, never covered by Medicare. And this is very important for us to understand. Long-term care is defined as 100 days or longer in skilled nursing or assisted living. And so that's not covered by Medicare. And if we need to think about long-term care solutions before beginning Medicare, because once you begin Medicare, it's very hard and sometimes impossible to obtain a long-term care policy. So the time to think about long-term care was before 65, not at 65. All right, so this is what a Medicare card looks like. Note that it's paper. I know you can't tell that from this screen. It's always paper, never plastic. Don't listen to the scammers that call you. They're just trying to get your Medicare number. Don't give it out. It will always be paper. It is a red, white, and blue card, and it has an alphanumeric code assigned to you that means absolutely nothing. It's totally random, and so nobody can look at your Medicare card and tell what state you're from or what your social is or anything about you based on that, and that's a very good thing. It used to have our social on it, and now it doesn't, and so we're happy that that changed. But now it's impossible to remember, so don't lose your card. You probably not memorize that card number anymore. So I know you cannot see this, but in your packet, and for those of you watching remotely, just know you can come by the Senior Center and pick up 2 documents called the Medicare Basics and the Road to Medicare. And any SHIIP volunteer will be able to give you those documents to help you out. But these are the cost sheets, and they are located in your packet inside of the Medicare Basics book. So this is the Medicare Part A document that tells us what's covered by original Medicare Part A. And you'll notice that there is an incident deductible, which means that when I go to a hospital, I'm going to be responsible for a deductible of $1,676 this year. And that's a lot of money, but it does buy me that whole incident period of the 60 days of inpatient care at no additional cost. And I'm just telling you right now, if you stick one big toe in a hospital, for just 5 minutes, you're going to ring up a bill over $1,676. So that is the deductible. But if I go home after I've paid this deductible and I've been discharged for more than 60 days, and I come back later in the year and I need to be readmitted, I'm gonna have to pay that deductible all over again. So we need to understand that deductible. It's pretty steep, because I don't know about y'all, but I don't usually have $1,676 just laying around the house, right? But that's my part of it. And like I said, we're gonna get the first 60 days at no additional copay. But on day 61, there's a per day copay of $419 per day, and that goes up on day 91 to over $800, so $858 per day. Now, 91 through 150 days in the same calendar year are what they call lifetime reserve days, meaning Medicare's only going to pay for that many inpatient days once in your lifetime. And they keep track of them really good. You don't have to, they will. So I just want you to understand that those lifetime reserve days, once and done, but those copays are really steep. Okay, now, beyond 150 days, 100% of that state is on you. Okay, now, other than that, most of the time, most of us, knock on wood, will not need more than 60 days in a calendar year inpatient in a hospital. So most people find Medicare Part A very easy. And most of us will not pay a dime for the premium. We're going to get that premium free if we've worked for at least 10 years, 40 quarters as they put it with Social Security. If you work those 10 years and you pay FICA taxes, or your spouse did, you will not have to pay a premium for your Medicare Part A. You're going to get this coverage at no additional premium. Now, if you've worked less than that, there are premiums that they're listed on that price sheet, and they are kind of steep. It's $285 if you work between 30 and 40 quarters. If you've worked less than 30 quarters, it's $518 a month. So the premium can be kind of steep. But like I said, the majority of us have paid our FICA taxes and we've worked 10 years or longer, and so we're going to get that premium free. We're also going to pay attention to the skilled nursing. So if I've been in the hospital 3 days or longer and I'm discharged to skilled nursing, I'm going to get the first 20 days 100% covered. That means I've only got 20 days to kick myself in the rear and get better. I need to get up and get out, right? Get rehab really fast, because if I take too long, day 21 through 100 is $209.50 per day. That is a pretty steep copay. And beyond 100 days, there's absolutely zero coverage. And you'll notice on here it also says that you have to pay for the first 3 pints of blood. Anyone who's ever had a blood transfusion during surgery knows that's very, very expensive. So that is the coverage that you're going to get with Medicare Part A. Now let's look at Part B. And Part B this year has a premium of $185 per month. And that's the majority of us that will pay that. Some of us will not have to pay that if we are eligible for a program called the Medicare Savings Program. It's a Medicaid product that pays that Part B premium on your behalf. And some of us may pay more than $185. So if you make more than $106,000 per year as a single person, or more than $212,000 a year as a married couple, you would be subject to IRMA, which is the income-related Medicare adjustment. And it's according to how much you make, how much more you'll pay for your Medicare Part B premium. But that is a potential issue for you. And so IRMA is a real thing, but Medicare Part B does have a deductible of $257 annually. But this is a calendar year deductible, which means pay it once and I'm done with the deductible. And once I've met that deductible, it is an 80-20 split between me and the federal government at that point. So Uncle Sam will pay 80% of my health care that's outpatient, and I'm going to pay 20%. And I would love to stand up here and tell you that it's just that simple, but I would be lying, and I was taught not to lie. So I'm going to tell you the truth. It's not that simple. There are things called excess charges, which is, let's say you go to a dermatologist and they bill Medicare $500. And you say, okay, well, $500. If you've met your deductible, Medicare will look at that and say, well, That's only worth $300. So they're gonna pay 80% of $300 because you've already met your deductible, and you're gonna pay 20% of $300. And you think you did good, right? You made it, you made a deal, you got it paid, it's all taken care of, but your doctor lost $200 in that negotiation. They can turn around and charge you 15% of what they lost. Those are excess charges. So, if your doctor so chooses, they may then turn around and say, you need to pay this 15% of what I lost, and those excess charges are 100% your problem. You have to pay all of that. So you'll pay 20%, you'll pay your $257 deductible, and if your doctor charges them, you'll also pay your excess charges. Now, preventative care is going to be covered at 100%, so you never have to worry about preventative care, which is really, really good. But again, those first 3 pints of blood are not covered. You covered those, and everything else runs on that 80-20 split. So it's a pretty good deal, all things considered. Now, for folks who received Medicare because they were in end-stage renal failure, if they receive a kidney transplant, they lose their Medicare eligibility 36 months after their kidney transplant. So they would no longer be eligible for full Medicare coverage. However, you can elect to keep immunosuppressive drug coverage, and the premium for that for 2025 is $110.40. And that's a very important thing to know, because if you're on Medicare due to end-stage renal failure, immunosuppressive drugs are very expensive, and you have to have a plan and show that you can accomplish paying for those drugs the rest of your life. And so Medicare will still keep you covered for that. So now I've talked about all these things that Medicare will not pay, that you're going to be responsible for. If that frightens you, let's talk about Medicare supplements. Because the one thing that I want to say to you is, while those 20% don't sound that bad, they also have no ceiling. There's no point at which you reach your maximum out of pocket. So 20% just keeps going and going and going. If I have a great health year, it's not that problematic. But if I have a really, really bad health year, that can be disastrous economically. And so that's where Medigap plans or Medicare supplement plans come in. Like I said, similar to comp and collision. They are secondary payers to Medicare. And so the great thing about these Medicare supplement plans is that they're standardized. And so unfortunately, they're alphabet lettered. I don't know why. So we have Medicare Part A, B, C, and D, but we also have Medicare supplement plans A, B, C, D, and on and on. And so I didn't create that mess, but we're stuck with it. But I do want to say that at least they're standardized, meaning that if I'm looking at a Plan G, for example, no matter if there are 50 companies that sell Plan G in my zip code, all of the Plan Gs cover the same set of gaps in Medicare coverage. And so when we're looking at Medicare supplements, a couple of things are important to know. One, we have initial right to buy a policy, but it's on a timeline, okay? Two, I'm going to pay that premium even if I never use it a single time. So just like comp and collision, right? If I buy that on my car, I don't have to have it. It's a good idea, though, if you have a hailstorm or a deer runs out in front of your car, because those things aren't covered by liability. So the same thing with our health. We're not required to take these secondary or supplemental plans, but they're a really good idea because you never know what might happen. But even if you never use it, if you have the best health year ever, and you didn't need that policy a single time, you still have to pay the premium every single month. And so some people find that frustrating. The other part of a supplemental plan that people find frustrating is the limited amount of time to purchase one that are guaranteed issued. And so it's very important for you to understand when you're allowed to purchase a plan and when you're guaranteed to get one. And so you have 6 months from the time Medicare A and B begin, 6 months of guaranteed issue. So if, as long as you obtain your Medicare supplement in that 6-month time period, they cannot turn you down. Regardless of your past health, they have to give you coverage. And so that's really good that pre-existing conditions will not count against you during that period of time. Now, each plan that's offered from different companies have a different premium, even though they may be the same plan. So we'll look at this standardization chart, and I know that it's too small really on this slide for you to grasp, but it is also in your book. The great thing about these plans is that they're all going to pay some of what you would normally pay. Okay? And if we're wanting to look at the most comprehensive plan available to today's current Medicare beneficiary, we're going to be looking at Plan G. So that's the one that covers the most. And if you have Plan G, for example, you'll never pay anything under Part A for hospitalization, because what Medicare approved and paid for, all of your part of that is paid now by your supplement plan. Okay? And then if we keep looking down through here, it's going to pay all of our 20%. Plan G is the only current plan that will pay excess charges. The only thing Plan G would not pay for me would be that $257 Part B deductible. And of course, that's calendar year again. So we're going to pay that once at the beginning of the year or whenever we go to the doctor for the first time, and then we're done for the year. Plan G is going to kick in and pay. Now, if Medicare says it's covered, then your secondary plan must also cover it, which means no networks, no hassles, no hoops. It's very easy to manage this care. What are some of the downsides? Well, one, that limited time, that limited guaranteed issue. The second is I'm paying for it even if I don't use it, but I'll probably use it eventually. And then the third bad thing about this, there's so much good about it, right, because it was easy, but the bad thing is that these policies increase as we age. Not necessarily because you age, but they will increase over time. We don't pay the same thing today for bread and milk that we paid 10 years ago, or for gas. We're not going to pay the same thing for our insurance policies. So we have to understand inflation and cost of living are going to impact the premiums that we pay for the plan. So they will increase as you age. Now, the other thing that I'll say about this is that there are two big terms that if you sit down with a SHIIP counselor, we're going to walk you through, and that's rating class and rating type. Rating type, we have 3 types in North Carolina. We have community rated plans, we have issue age policies, and then we have attained age policies. And the rating type tells me how often and for what reason that plan can increase. It can increase more than just once a year due to inflation. It can also increase for other reasons, like simply because you had a birthday, okay? And then there are rating classes, which tell us if there are any caveats or anything special about that plan, any extras they offer, or any hoops they expect you to jump through. And so those are 2 very important terms as a consumer that you need to understand about your policy. What type of policy do you have? What letter policy do you have? What rating class is that policy? So when you sit down with a SHIIP counselor, we're going to help you with that. We're going to make sure that you understand those terms, and that you understand how they're going to impact you over time and how they may impact the price you pay for your insurance premiums. All right, now, we're still on this original Medicare, kids. We've got to talk about Medicare Part D. Medicare Part D are those prescription drug plans that work with original Medicare. Absolutely anybody who has Medicare A and or B is eligible to purchase a Medicare prescription drug plan. They are private companies, but they do have rules that they have to follow provided to them because they have a contract with Medicare. Now, these plans change drastically from one year to the next. Their premiums, their in-network pharmacies, their formularies, which is the list of drugs that they officially cover. Everything about that plan could change, their deductibles, their copays. It's very important for you to know that if you have a Part D drug plan, you are not stuck forever. Once you pick it, we want you to make sure you come back every year and sit down with a SHIIP counselor, or just do it on your own, but look at your plan carefully. October 15th through December 7th is your chance to make a change. And I encourage you to review it. Even if you love your plan this year, even if it was the best option out there and you have had nothing but wonderful success with this plan this year, you need to review it for next year. So remember, when you start seeing pumpkins on the ground, it's time to go find your SHIIP counselor and talk about that plan and make sure it's going to be good for next year. And you know, that is one thing that I think a lot of people fail to do is look at that plan each year. And that's the one thing we're going to tell you at SHIIP. So when can I enroll in a Medicare Part D plan? Obviously during my initial 7-month enrollment period. Also during that annual enrollment period, that was October 15th through December 7th. And if you enroll during that time, your plan does not begin until January 1st. And then of course there are other times. So if I did pick an Advantage plan and at any point I want to leave that plan and return to original Medicare, if I use the Medicare Advantage open enrollment period, January through March, to leave an Advantage plan, I'm allowed during that time to pick up a drug plan. And there may be special enrollment periods, so maybe perhaps I filled out an application for some financial assistance and I'm awarded financial assistance. If that happens, that will make me have a special enrollment period to change my plan to a plan that would work better with that financial assistance. So in talking about that, that of course segues beautifully into the next slide, which is all about the Extra Help program. So Extra Help is a program where eligibility is determined by the Social Security office. If you show up here and you're sitting down with a SHIIP counselor like Waylon or myself, we're always going to ask you about your income and assets, not because we're nosy, because we don't charge anything for our services, but because we want to make sure that if you are eligible for these programs, that you're made aware of them and we can help you apply for them. So what the Extra Help program does is it works alongside of your Medicare Part D to decrease or even eliminate your co-pays, your deductibles, and your premiums for your drug plans. So we always want to ask you about that to see if you qualify. All right, so we've talked all about original Medicare. Let's now look at Medicare Advantage plans and talk about how they're different and what the pros and cons of Advantage plans are. Because while they are still Medicare, they work very differently from original Medicare. So Medicare Advantage plans are just another way to receive the Medicare benefits that we are due already. They are private companies, and with these companies, you may have additional rules. So you may have to get a referral to see a specialist. You may have to obtain prior authorization, and the need for prior authorizations for blood work, x-rays, procedures has drastically increased over the last few years. So I promise you, you'll probably hear the words prior authorization if you have an Advantage plan. Okay? That doesn't necessarily mean you'll get denied those services, but you will have additional steps to accomplish your care. So I just want you to understand how they work. They work by creating a network, an in-network group of doctors and services that can provide your health care, but at discounted rates, okay? Now, the way most Advantage plans work is you pay little or no additional premium other than your Part B. So yes, you still pay that $185 for Medicare Part B to Uncle Sam, but you will not be allowed to pick up a supplement. You will not be allowed to pick up a standalone drug plan. Medicare Advantage plans are designed to be all-inclusive, to be everything you're going to have. That company has made a contract with Medicare saying, I provide everything for this patient, and it's all about my rules, okay? Which means if I have original Medicare and I go to a dermatologist and they want to do a biopsy or they want to freeze something off of me while I'm there, they can probably go ahead and do it because I'm not in a managed care plan. But if I have an Advantage plan, I will see the dermatologist, and if they want to do anything, I may have to make a second appointment and come back after they've obtained prior authorization. Does that mean I won't still get that procedure? No. It just means I won't get it on the same day. Okay, I may have to come back. And it does potentially mean I won't get it because I might not meet the standard of care that they believe requires that procedure. Okay? So if your plan thinks that, no, that's not really necessary, they don't really have to freeze that off there, there's no indication that it's required, you may get a denied procedure. You have options if you're denied. We can help you file an appeal. Appeals are won a good percent of the time. About 50% of the time, appeals are won. But that means 50% of the time, appeals are lost. So I don't know if you're glass half full or glass half empty, but it is something you have to think about. The other thing is that network that we discussed. Trust and believe if you're in an Advantage plan, you will have a network and you will need to comply with the network in order to make the plan pay the most. But the great thing about these networks is they keep your cost very low if you follow the rules. Okay? So if I have an Advantage plan, I'm not paying anything for a supplement, I'm not paying anything for a drug plan. And I'm probably going to find a plan under the Advantage plan side of things that has no additional premium. So I may pay nothing other than $185 a month, but it's pay as you go. So if I don't use it that month, hey, I'm happy. I paid nothing out of my pocket. But if I have a really bad health year and I use it a lot, every single time I use the service, if I followed the rules, I've kept my cost low because I'm just paying a copay. So that copay may be $50 to see a specialist. It may be $0 to see my primary care. So if I go to see a primary care doctor, it could be no copay at all. And so if I'm constantly seeing the primary care and I don't have a lot of specialists and I don't have a lot of procedures, I'm going to be real happy with my Advantage plan because my costs were very low this year. But if I have a terrible health year, at least I have the comfort of knowing there is a maximum out of pocket, which we did not see with original Medicare. So there is a stop to the hemorrhage, but there are some exclusions. So if I'm in an HMO, for example, and I'm in this particular plan and I decide I'm going to go out of their in-network and I'm going to see somebody I want to see, I'm going to pay 100% of that out of my pocket because I did not follow the plan rules. The same thing would go if I have a procedure that required prior authorization and I got denied and I decide I'm going to have it anyway. Well, that does not go toward my maximum out of pocket because I did not follow the plan rules. I did my own thing. Well, I'm going to pay for that 100% out of my pocket. And so those are some of the things that you might encounter with an Advantage plan. Now, we have some tools to argue our point, but we're not guaranteed that we'll win an argument with them, okay? We're also not guaranteed that our doctors will stay in that network. They can and do leave the networks, and they can do so after we've already passed the time that we can make a change. So we may have to suffer through changing our doctor against our will middle of the year, okay? Now, there are some reasons that I might be able to wiggle myself out of an Advantage plan, but most of the time I'm going to be stuck with it for the year. So I want to make sure that I'm making the best decision about that Advantage plan that I can possibly make. That I've looked at their rules, I've looked at their network, I'm pretty happy with their coverage and with what they will or won't take care of. And the other thing about an Advantage plan is there are extras. There are some sweet little things that they throw on the top as icing on the cake. So one thing is dental and vision. It could include transportation or meals if we've been in the hospital for an extended period of time and we return home. There are some things. Now, I know that we heard Joe Namath and J.J. Thomas and Will Shatner all talk about Advantage plans, and they made it sound wonderful. And in some cases, Advantage plans are the best thing out there, but they're not for everybody. Absolutely not a one-size-fits-all with Medicare. Some people will be on the Advantage plan route, and they will love every minute of it for the rest of their time. Other people, it is a disaster for them. And so we want you to sit down and really think about what are you flexible about, what are you not flexible about. So my mom has an Advantage plan. She has loved it, has always loved it. She's done really well, and she made good decisions, had good plans, and had good coverage. Had no problems really until 1 year. 1 year out of all the years she's been under Advantage plan has she had a bad year, okay? But a couple of things went wrong, and we didn't win some appeals, and she had a procedure that wasn't approved. And so she had one bad health year and one bad Medicare Advantage year, but all the rest of the years she kind of made out like a bandit, paid very little for her health care and did really well. My husband alternatively chose the original Medicare path, Why? Because he said, I am not going to be told what doctor to see. He's very stubborn. He is not going to go in network. He does not want to fool with making phone calls to find out, is this one in network? Did that get approval? I have to go 3 times to the doctor because I didn't get prior authorization. He didn't want to fool with any of that. Mom is fine with it, right? So Advantage plans can be really, really great tools for you and can offer you some additional services. Am I going to tell you that they are always great for everybody? No. Am I going to tell you you'll never have a problem with it? No. But I am going to tell you that it does help you become a smarter consumer in terms of where you go and what you have done. And it also gives you incentives to take better care of yourself. And so there are some good things about Advantage plans. You will hear terrible stories and you will hear great stories. That's why I tell you it's not one size fits all. We need to ask a lot of nosy questions to find out if an Advantage plan really is an advantage for you or if it would be a disadvantage for you. All right, so when can I enroll in an Advantage plan? During my initial enrollment period, of course. Also, during the Advantage plan enrollment period, which is January through March of each year, and of course during the annual Medicare open enrollment period, which is when most people are looking at their drug plans. You can also look at your Advantage plan. So you may also qualify for special enrollment periods. If you are on an Advantage plan and you move to a different zip code, you will need to change your Advantage plan. All right, so let's kind of do a recap. Original Medicare versus Advantage plans. How are they alike? How are they different? They're both going to cover inpatient and outpatient care. And the Advantage plan may cover additional things like vision or dental for you. And if you have Original Medicare, these services are provided to you directly by the federal government, and they're provided by private companies if you have an Advantage plan. If you have Original Medicare, you have no network. You can go to any doctor that you want to see, any hospital, and you'll be fine. But if you have an Advantage plan, you will have a strict network that you will need to follow. And of course, under Original Medicare, you or your supplement will pay deductibles and copays. And under most of the Advantage plans, you're going to have copays, okay, for most services. And then if you have Original Medicare, you're still going to pay your monthly Part B premium. And under Advantage plans, you're still going to pay your monthly Part B premium, and you may have additional premiums to pay to have the Advantage plan itself. You may not. Now let's talk about the difference between the Medicare Advantage plans and the Medicare supplement plans. Remember that Medigap or supplemental policies only work with Original Medicare, and they are offered by private companies. Now, government oversight is provided not only by the federal government, but also by the state, versus Advantage plans are private companies with contracts through the federal government. They do not work with Original Medicare, they replace it, okay? Now, both of them are going to cover you if you have inpatient or outpatient needs, but remember that a supplement plan pays after Medicare has already paid, and it's going to pay the other things that would be coming due by you, but they're going to pay it on your behalf because you're paying them to cover that. With an Advantage plan, all Medicare claims go to that company and they charge you your copays or your percents based on which plan you've chosen. Now, you do have to have Medicare A and B to have either a supplement or an Advantage plan. You must have both of them. You cannot just have Part A or just Part B. You gotta have both. And then of course, yes, you'll have additional premiums for the supplement, of course, as well as the Part B premium. And under Medicare Advantage, you'll pay your Part B premium and potentially a small premium for that Advantage plan. So that brings us to the slide where we talk about what if we can't afford Medicare itself. That $185 can be really difficult to come up with. So So I want you to know there are some programs offered by the Department of Health and Human Services. You can apply through your local Department of Social Services or DSS, or you can come here and we can help you apply for that program. And there is a type of Medicare, a type of Medicaid that pays your Medicare Part B premium. And then there's also full Medicaid, which would not only pay your premiums, but also your co-pays. So they offer you not only automatic eligibility, if you qualify for those programs, you're automatically going to get the extra help program. But in addition to that, it offers you a special enrollment window to change your plan according to what you need. So I always want to talk about the fact that Medicare covers preventative care. I think we often forget to take advantage of this great service. It is offered through Medicare at 100% coverage, whether we have original or whether we have an advantage plan. We can always obtain preventative care for free. So the Medicare Renew Handbook, which you're going to get once you become Medicare eligible, they're going to mail you one every year. And we have this lovely guide to Medicare preventative services that you can pick up from us. And it allows you to see the list of things that they consider preventative care. Things like vaccines and eye health exams and mammograms and A1Cs and cholesterol checks. All those are important preventative care things, that services that we need to accomplish each year. Just remember there is a difference in preventative that's covered at 100% and things that are diagnostic in nature. So if I do an annual mammogram and I say to the doctor I feel something, it's now going to be a diagnostic mammogram. Same thing happens with colonoscopies. People think that the colonoscopy is preventative, and in most cases it is. But if they're in there and they see a polyp and they remove it, it's now a diagnostic colonoscopy, and you'll be paying for diagnostic care instead of preventative. And I'll touch briefly on this slide. The Inflation Reduction Act, at this point it's still in place, and so we'll talk about that. One of the things that did was help ensure that there's at least one insulin product on every drug plan formulary, and that drug, if it's on the drug plan formulary, you're going to get your insulin for $35 or less. It does not mean that all insulins are on all formularies, but it does mean that every single Medicare plan must offer at least one insulin for $35 or less per month. I think that's great. They also had to expand and cover all recommended vaccines and offer 100% coverage. Now, the other thing that it's done, it has eliminated the 5% catastrophic copays. So if we've paid enough out of our pocket for drugs in a year, we'll have no copays. We'll see zeros start happening instead of that donut hole. And this year, it started a $2,000 maximum for drug copays, meaning that once I have paid $2,000 out of my pocket, as long as all my drugs are on the plan formulary, I'll never pay more than $2,000 in a year for my drugs. But if I'm selecting a drug that's not on the formulary, I will pay all of that, right? Like, that doesn't help me with drugs not listed on the formulary, nor does it help me, or nor does it include the premium for that plan. So that's not part of the $2,000, but the drug copays themselves are capped at $2,000 if your drugs are on the formulary. And I encourage you, strongly urge you to sit down with the SHIIP counselor. Let us put your medications into that plan finder tool that we use on Medicare.gov, and we can tell you what is and is not on the formulary each year. Very important to pick the correct one. And another great service that you're going to get if you come to a SHIIP counselor is we're also trained as North Carolina's Senior Medicare Patrol Program ambassadors. So that means that we are going to help you learn about Medicare fraud, waste, and abuse. We're going to help you learn to protect yourself against it, to detect it, to find out if it's happening, and how to report that. So last year, and several years before that, we were losing $68 billion a year nationally to Medicare fraud. And now it's only $60 billion. That's a lot of money, right? And we know that Medicare cannot remain sustainable if we continue to lose $60 billion a year. So we want you to understand how to to report it, how to detect it, and how to protect yourself initially from that. One big thing is please stop answering the phone. If you don't recognize the number, don't answer it. Let it go to voicemail.
And then block it.
That's just don't answer it. Let it go to voicemail. Listen to the voicemail. You'll be able to tell probably if it's somebody who's trying to sell you something or somebody trying to scam you. But I encourage you not to call the number back that they leave. If they leave a number, don't call that number. If they say, I'm from Medicare, just hang up the phone, call your local SHIIP counselor and say, what's the number for Medicare? We'll give you the actual number for Medicare. Because chances are the person will say they're from Medicare and they're not. Medicare almost never calls you unless you make an appointment, right? And of course, they don't issue plastic cards. They don't make home visits. It's all baloney. It's just devising a way to get your Medicare number so they can bill a bunch of stuff to you that you're not using or needing. So we want to make sure that we're figuring these things out and we're getting ahead of them. So tell your friends. And by the way, if you stop answering the calls, you will get far less of those calls. I used to get about 30 a day. No lie. I stopped answering the phone. Now I get 4 calls maybe. And so that's a big difference. And I suspect if I keep not answering the phone initially, they're eventually going to figure that's a dead number and they'll stop calling me. So that's how you get rid of the calls. Now, I mentioned earlier that we use Medicare.gov as our plan finder tool. And so when you come to a SHIIP counselor, that's the first thing we're going to do is we're going to create, if you don't already have one, we'll help you create an account. We're not putting your information out there. It's already there. It's in the Medicare database. Medicare.gov allows you to create an account so that you can see what they know about you. Okay, so you can look at your claims. You can put your drugs in and find out if they're covered by your current drug plan. Lots of information is available to you, and you can do a lot of things on Medicare.gov, like see what a new drug would cost. It will help you have a calendar of preventative events, even pay your premiums online. So we're going to encourage you to utilize the Medicare.gov account often. And then finally, if you've listened to this talk today and you think, wow, I really could do this, I could help people in my community learn about Medicare and make good decisions and help them with their Medicare plans, we would love to have you as a volunteer. You'll come here and you'll see Waylon Prebor here at the Senior Center, and he'll take an application from you and sign you right up. And you'll get to see me 4 times a year, as I'm the one that conducts the training for the volunteers. But it is a great way to feel really good and to contribute to your community. And believe me, there are lots of people in your community who are struggling with Medicare questions and really could use extra help. So we're always looking for volunteers. So I'll put this slide up now. Where can you get help? Well, those of you who are here in person, you've got that folder. My card's in the front of it. You know you can come here anytime and talk to Waylon at the Senior Center and his group of volunteers. But in addition to that, we do have a Raleigh call center, and that is 855-408-1212. It's toll free Monday through Friday, 8 to 5. You can also go on our website, www.ncship.com. You can call Medicare. Again, the number is listed here. It's nationwide toll-free, 24 hours a day, 7 days a week. That's 1-800-633-4227. You can also go on their website, www.medicare.gov. Make sure it's .gov. And then the Social Security Administration. Again, I'm going to urge you to seek out your local Social Security Administration, not use this nationwide toll-free number, but the nationwide toll-free number is there for you if you need it. And again, it's Monday through Friday. It's supposed to say 7 to 7, but it says 8 to 7. But either way, you'll be able to reach somebody toll-free if you need them. And then, of course, your handbook. Medicare and You 2025. I have a couple of copies here should you need one, and you can always come here to the Senior Center, but once you start Medicare, you'll get one of those every year. So are there any questions before we end today's presentation? All right. was nice to spend time with you today, and I appreciate all your time and attention. And if you need us, we are here at the Senior Center, and you can stop by and see us anytime.